take this opportunity to greet you once again, and this is Frokil Show, a show that promised to inform, share, and educate. In our episode today, we are looking at a health-related condition, and this health condition is what is known as sciatica. Sciatica isn't a condition by itself. It is a symptom of an underlying medical condition affecting the sciatic nerve, the longest and weakest nerve in your body, and it originates in your lumbar spine or lower back and travels down through the buttocks, back of the thigh, and into the leg. When this nerve is compressed or irritated, it causes that classic shooting, burning, or radiating pain down the leg. It usually affects only one side of the body. And what are the root causes of sciatica? One of the causes is what we call herniated disc or slipped disc. Along the spinal cord, we have the arrangements of the discs. Sometimes, if the disc is herniated, then it can result in this condition. That is, the soft inner part of the spine, the spinal disc, bulges out and presses on the sciatic nerve. The cause number 2 is degenerative disc disease. Age-related wear and tear can irritate or compress nerve roots. You have had many more people complaining about this condition with old age. The third cause is spinal stenosis. That is, narrowing of the spinal canal reduces space for nerves. The fourth cause of sciatica is spondylolisthesis, and this is where one of the vertebrae slips over another, potentially pinching the sciatic nerve. We have the fifth cause, which is piriformis syndrome. A tight or spasming piriformis muscle in the buttock presses on the nerve. And number 6 is trauma or tumors. Trauma is, for example, when we have an accident and probably you have experienced some injury at the back. And especially it happens when someone accidentally falls on stairs or maybe through the car accident and so on. And of course, the tumor, where we have some growth of the cells around the sciatic nerve. And who is at a risk of experiencing sciatica? People aged between 30 and 60 years. And the second group is people with sedentary jobs or who sit for long periods, and especially the long distance drivers. Number 3 is those doing heavy lifting, twisting, or repetitive motion. Number 4, diabetic cases. Number 5, pregnant individuals due to posture and pressure on the pelvis, and especially for those people who are bed short. During pregnancy, maybe in the last trimester, we might have that change of pressing of the spinal cord as the body repositions itself for the incoming newborn. And the other one is smokers, which is linked to disc degeneration. What are some of the symptoms? Most common symptoms will include radiating pain from the lower spine to the buttock and down the back of the leg. The other symptom is pain that worsens with the movement or prolonged sitting. And the other symptom is tingling or numbness or muscle weakness in the affected leg or foot. Then the other symptom is pain, typically on the one side of the body, and especially from the lower part of the back down to one side of the leg. Then what are the treatment options? The first option is self-care or conservative measures. Rest, short-term. The treatment options will include 1, stretching and gentle movement, especially hamstrings and lower back. Then Of course, at times we might take over-the-counter non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, but this one will only reduce the pain, and it's just for a moment. Number 2 is physical therapy, strengthening exercises for core and lower back, and improving posture and flexibility. Then you target stretches like yoga-based moves. Then number 3 is medical intervention. We might have taking some muscle relaxants, nerve pain medications, gabapentin, pregabalin, or you can take cortisone injections for inflammation. And of course, you can also have some nerve blocks in severe cases. But I would like to give a warning here that medical treatment of this condition may bring in some other long-term complications, because the medication that you are taking mostly ends up suppressing the pain from the brain. You become dependent on the drugs, or you develop what we call tolerance. These drugs also have side effects, and especially on the part of the brain. And what are the long-term management and prevention? Proper posture and ergonomic setup at work, lifting with your legs, not your back. And then healthy weight to reduce pressure on the spine. And then, of course, if you are a smoker, you can consider quitting smoking. And then stretching regularly, especially hip flexors, hamstrings, and lower back. Thank you so much for viewing Folklore Show. I'm sure we have shared a few of the hints of this condition. At times, some have suffered from it and they don't know exactly what it is. And at times, also, the treatment has also become a little bit complicated. Then our viewers need to know some of the consequences. Thank you so much. Continue viewing Folklore Show. Consider subscribing to our channel so that once we give more videos, you get an alert. Thank you so much.